Hi, my name is Bailey Baker, senior at the College of Nursing here at the University of Cincinnati. Presenting with me today are my fellow classmates Haley Fox and Corinne Sherman. We are excited to share with you today our capstone presentation on improving pediatric registered nurses' knowledge on coping skills and available resources surrounding the loss of a patient. As soon-to-be graduate nurses with the potential to face the loss of a patient, we wanted to educate nurses on means to reduce negative effects from losing a patient. According to BMC Palliative Care, 92% of nurses in their study expressed concerns about providing end-of-life care. Without proper education on effective resources, training, and coping skills, pediatric registered nurses can suffer short and long-term consequences due to the loss of a patient. Negative effects from losing a patient include stress, burnout, compassion fatigue, among many other things nurses can experience. When speaking to nurses on our respective clinical floors, one nurse stated that she felt that there were not enough resources available to help her and her fellow nurses through the process to cope with the grief. Another nurse stated that it was a heart-wrenching experience, and she felt that the death of her patient was her fault that day, and to this present day still feels responsible for the death. Knowing that, we wish to educate nurses on these things. We developed a PICO question reading. In pediatric registered nurses experiencing the loss of a pediatric patient, what is the impact of receiving education on coping skills and available resources surrounding the loss of a pediatric patient? On their post-test knowledge of the education received compared to their pre-test knowledge before the education was received. To conduct a literature search on our PICO question, we utilized CINAHL and PubMed through the UC College of Nursing library with Boolean logic and keywords such as pediatric nurse, coping skills, pediatric death, amongst others, to select a total of 26 articles ranging from 2014 to 2021 to analyze and create objectives for our capstone education project. Our education plan was implemented at Cincinnati Children's Hospital Medical Center, specifically A6, which is a medical surgical unit, and A7, which is a neuroscience unit. Our goal for the education plan was to teach pediatric nurses on effective coping skills, resources, education, and training surrounding the loss of a patient to minimize negative effects. The topic was important to our group because we take care of multiple chronic patients on our role transition floors. The education plan we used focuses on 3 objectives, and the overall aim from the objectives was by the end of the presentation, nurses would be able to identify educational strategies that need to be in place for nurses and students, identify resources and strategies available, and lastly, identify effective coping strategies after the loss of a patient. To implement our project, our group sent out an educational PowerPoint to register nurses on A6 and A7 at Children's on March 8th. In order to measure our results, we used a pre and post test to determine how much the nurses learned. The registered nurses were first told to complete the pre-test without looking at the PowerPoint, and then after viewing the PowerPoint, they were instructed to fill out the post-test. The pre and post tests were used to analyze if the nurses had met the 3 objectives and to see if the overall education was a success.
The following is what resulted from reviewing the responses that we received on the pre-test and the post-test. Overall, nurses reported receiving little to no education prior to our PowerPoint on how to handle a situation regarding the loss of a patient. Prior to reviewing the PowerPoint, nurses stated coping strategies such as self-care and exercise. After the education, nurses were able to state new coping mechanisms. The nurses were also able to show new knowledge of resources available to them at Cincinnati Children's. The nurses were able to state the benefits of large interdisciplinary teams, as well as ways to include family in the end-of-life and grieving process. All nurses who participated stated that the education was helpful and it made them feel more prepared to handle a loss in the future. After reviewing the current literature on this topic and the responses and feedback from the registered nurses who participated, we formulated recommendations for future practice. Our recommendations all revolve around education. We believe that education surrounding coping strategies should be implemented in new higher orientation at healthcare organizations. Nurses should also be educated on the available resources that are available to them through their workplace. This should also be taught at new higher orientation and throughout their career as resources change or when new resources are added. It is also important to have early education in nursing school. This could include grief or end-of-life simulations so that students can get hands-on experience about how to deal with these types of situations. And these are our references. Thank you for watching our capstone presentation.